So a lot of people ask, when I recommend acupuncture, they usually say, yeah, let's do it. And then when they're lying on the table, they wonder to themselves, what the heck is going on here? What does acupuncture actually do? How do I know that this guy's not just stabbing random needles into me? And those are all perfectly good questions to ask, and questions that I had to ask myself while I was in acupuncture school. It's a very complex answer, but basically, acupuncture can treat just about anything, and that's because it works on 3 different tissues in the body. Now, these tissues affect every single cell in your entire body, which is why acupuncture can work so well in so many different things. 1, we know that acupuncture affects the nervous system. We have lots of studies to show that when we put needles in different acupuncture points, that we activate and deactivate different parts of the brain. 2, we know that acupuncture can change blood flow throughout the body. And again, we have this is the golden age of acupuncture right now, because we're using all of our new high-tech stuff to prove that the Chinese dudes on a mountaintop 5,000 years ago were totally right in what they were saying. Maybe they use different words than we use now. But 2, the acupuncture can either increase or decrease blood flow. Now, if you have allergies, you might want to increase blood flow through your liver to reduce histamines in the body. But if you have a swollen knee, we might want to decrease blood flow in that knee to reduce the swelling. And acupuncture can do both those things. 3rd, acupuncture relaxes the fascial system. Now, that's the one nobody ever talks about. The only people who care are surgeons and physical therapists, okay? And now if you take the fascial planes that physical therapists and surgeons care about, and you take the acupuncture meridians or channels, you find that they actually overlap perfectly. So we know the acupuncture channels are made from the fascial tissue. Now, fascia is what gives our whole body its shape, its size. Why is your liver liver-shaped? Because your fascia holds it in that shape. Now, what we can do, if I needle liver 3, which is down next to your big toe, it'll actually relax and change the fascia up around the liver. It'll also change the fascia around the shoulder and the elbow, which is why I might treat your shoulder pain on the right side by sticking a needle in your left foot. All right? Now, that's the hard part. How do we know which points to needle? And I'm not going to go into that because it's super complex, and you've got to go to school for a long time to figure it out. So let's talk specifically about diarrhea. Nobody talks more about, no chiropractors talk as much about diarrhea as I do, because so many people suffer with it. I know you're suffering with it too, on and off or constantly. I see it all the time. Now, when we're dealing with diarrhea, we are talking about spleen qi deficiency. So in Chinese medicine, the spleen and the stomach have to be in balance. Chinese medicine is all about balance. The stomach is continually moving things down, while the spleen is continually moving things up in the digestive system. Now, if your spleen or pancreas is under-functioning, the qi is not balancing the downward motion. There's not enough upward motion to counteract the downward motion. So the stomach forces food through the gut too quickly, and this presents as diarrhea. So in Chinese medicine, we're going to be working on the spleen and pancreas to treat diarrhea. Now, if we take a Western model of that, oftentimes a very common cause of diarrhea is parasitic infection and enzyme deficiency, both of which will cause diarrhea, both of which usually present with a weak pancreas. So if you come in with diarrhea, we're going to be working on some nutritional support for the pancreas and gut as a whole, but we're also going to be needling the spleen channel using acupuncture.